Hello everybody, my name is Vincent Lutterby. I'm a dentist with the state of Missouri. I've worked with the state of Missouri for 22 years with people with disabilities. We have seen many people come and go. There are many different things that you can deal with, but the most important thing I want to stress today is that we need to work with home care and communication with your dental professional.
Hi, my name is Anna. For the last 18 years, I have worked with people who have cognitive and developmental disabilities. Today, I'm going to try to give you some helpful hints for assisting them with their oral care. One of the questions you probably have is, how often do we need to brush? Ideally, we should brush every time we eat. Realistically, with these clients, if we can brush in the morning and at night at bedtime, we should be okay. We want to brush in the morning to clean out the mouth, freshen the breath, get rid of the bacteria that's been there overnight. At night before going to bed, it's extremely important because we want to get everything out of the mouth that's been acquired during the daytime. We particularly want to stop the bacteria from colonizing overnight. We need to brush and floss daily to remove the food debris, plaque, and bacteria which are in the mouth. The food debris provides food for the bacteria. The bacteria then creates the plaque, which then sticks to the teeth. That's that sticky white stuff you see when you look in someone's mouth. That sticky white stuff, the plaque, is acid-based. It irritates the gums and eats at the teeth. You've seen people with red, inflamed gingiva gums. This is from the acid irritating them. If we do not clean them off daily, get all of that stuff off there, then the gums become more and more unhealthy. And as they do, they want to back away from the irritant. So you've got your tooth, the plaque's here, and the gums start to back away from it, farther down the root. Well, as it does that, the plaque and irritant follows it. That gives it more space to collect. And pretty soon, the gums backed away, and now the bone's starting to back away also. And then we have a tooth that starts to wiggle, because the only thing holding that bone in place, that tooth in place, is the bone. Without the bone, it's going to wobble around. We need to keep the mouth clean to avoid this situation. What about dentures? Do they need to be cleaned? Sure. They need to be cleaned every time you eat, just like your teeth do. The dentures, each time the client eats, should be taken out and rinsed off. Also, the mouth should be rinsed out. Just have them swish and spit the water back out. It kind of cleans the debris out. If we do not do this, the food debris packs underneath the denture. Remember that about it being acid? Well, it irritates the gums then. So we need to take the dentures out, rinse every time we eat, rinse them off and put them back in. Once a day, they need to be fully cleaned. Get a denture brush and scrub them. The same thing that gets on the teeth gets on the dentures, plaque. And over time, it'll get hard, and you've got all kinds of buildup on the dentures then. So each night, take the teeth out, the dentures out, brush them well inside and out, then put them in liquid overnight, whether it's a denture cleanser or just water. Leave them out overnight. This is extremely important because if we do not leave them out overnight, the gums do not have a chance to breathe. All day they've been covered up. They need to be able to breathe. Also, it helps stimulate the gums. We need to brush the tongue and the gums also each night. That brushing them stimulates them, gets the blood flow going well through the gums, and the tongue needs to be brushed for the same reasons. Plus, if you've ever looked at a tongue, it has a very rough surface. It collects all kinds of stuff. Brush it, you'll freshen the mouth, feel a lot better for it. But absolutely leave those dentures out overnight, because if not, you're setting up an ideal environment for future problems, such as oral cancer. If you've ever walked through the oral care aisle at your local store, you know that there are an unlimited number of possibilities and items that you can use. Then you've got to make the decision on which ones do we use. The ones you use depend on the individual you're working with. You decide the size of the toothbrush by the size of their mouth. These toothbrushes, you've got your adult toothbrush, your child toothbrushes. Those are just terms. They're not limitations. Think of them as a small head and a large head, and pick the one that fits in the client's mouth the best. If they have a small mouth, you don't want to put a great big toothbrush in there because it can hurt. So pick a littler one and go with that. What about power brushes? There's even different kinds of those. You've got your basic spin brush. You've got the multi-headed power brushes, and you've got the toothbrushes that cost $100 that are the power brushes. Pick what's appropriate for the client you're dealing with. The power brushes come in very handy if you have someone with limited fine motor skills. If you've had head injuries, a lot of the different physical difficulties create fine motor skill difficulties. Years ago, I broke my neck and discovered firsthand how difficult it can be to brush your teeth if you don't have fine motor skills. This particular toothbrush handles those skills. It does the going round and around, up and down. You can put it in the mouth and move it slowly around the mouth, not fast, because you're not allowing it to do its job. It needs to move slowly over each area of the mouth, each tooth, and it's doing the round and round, the up and down, back and forth, those motions that are very difficult to do if you don't have good control of your hand and arm. If someone is interested, we have the multi-head power brushes. These go on either side. This goes on either side of the teeth and gets both sides at once. It's a neat instrument, and there are points when it can become really handy. A lot of clients like it. It's fun to use. If it's fun to use, they'll use it. Sounds like a great plan. We also have, I mentioned earlier, a denture brush. It is a specific type of brush. You do not use regular toothbrushes on the denture. This is designed to get down in the grooves of the denture and to actually clean it properly. Now, obviously, this is just one brand. They come in a lot of different kinds, but make sure you get an actual denture brush for the denture. Flossing. There's a lot of different kinds of ways to floss. We have the traditional. Take the floss out, wrap it around the fingers, and floss the teeth. Now, that's difficult to do if you have wonderful coordination. It's really difficult to do if somebody's trying to bite you. So there are other options available. There are numerous different kinds of floss holders. This particular one works pretty well because it allows you to be a little farther away from those teeth while you work on them. Keeps those fingers from being in there in range. Now, a lot of times I said biting. A lot of times it's an involuntary closing of the mouth. It's not even intentional biting, but it still hurts. So you want to keep those fingers whole and healthy. This goes into the mouth, in between the teeth, and pops back out. Pop it between the teeth, move it up and down the sides, and back out. This head is disposable. You can actually buy like packages of disposable heads for it. That will make it much easier to floss somebody else's teeth, and it also makes it easier for a person to floss their own teeth if they have difficulty with coordination. Toothpaste. I told you it didn't make any difference, right? It doesn't. Generic, name brand, makes no difference. The other thing, you watch the commercials for toothpaste, and they tell you to put the toothpaste on with a little swirl, which is really pretty. But if you've ever stuck that much toothpaste in your mouth, you know you foam for about a week. You can brush the teeth with no more toothpaste than that. Maybe up to the size of a pea is what's recommended. That will eliminate part of that foaming. And a lot of our clients have difficulty with all the foaming, the swallowing, the gagging and everything. You don't want to stick a bunch of stuff in there that's going to make it more difficult to brush their teeth. Don't create any more problems for yourself than you have to. So stick with just a little bit of toothpaste. You're probably wondering why you have to do this at all. The client doesn't appreciate it. It's a lot of work. It just doesn't seem to be worth it. Well, we have to do it because it's no longer optional. Not brushing the teeth is considered a form of neglect. Also, it's a health issue. You're dealing with potential chronic infection, and a lot of health issues are involved with that. Because of that bacteria that's in the mouth, you can have a low-grade, if those gums get all inflamed like that, that's a low-grade infection. So you now have a low-grade infection in the mouth at all times. The bacteria that's found in the mouth is also found in about 70 to 80% of the pneumonias that our clients get. The bacteria originates in the mouth. If they have diabetes, anyone that deals with diabetes knows you have to keep the infection out of your system. If you've got low-grade infection, you are always going to have problems with the blood sugar levels. This can also affect osteoporosis, the heart. A lot of things can be affected by that inflammation. Also, we have an issue of social acceptability. We want our clients to be able to move about the community freely and be accepted by the community. If the mouth is filthy, if there's a strong odor coming from the mouth, this makes it more difficult for people to accept them. If you walk up to somebody and try to talk to them and they have really bad breath, we tend to back away. So if we can make it easier for the community to accept them, then we've done them a service. Also, their self-image is involved. They know that people are responding negatively to them. If they have teeth that don't look very pretty, then they don't feel very pretty. And what about dental pain? Well, we know it's not a fun thing. If you've ever had a toothache, you know how irritable it makes you. Well, we're dealing with a clientele that a lot of times is unable to communicate to us whether or not they are in pain. To get around this, you need to watch for other symptoms. If someone begins to be irritable when they eat ice cream or some other food that they've always really enjoyed, or even just quit eating, they don't want stuff in their mouth and they're giving you a hard time over it, or their temperament has just bottomed out. They used to be relatively pleasant, and all of a sudden they're not the best person to be around anymore. One of the things you may want to consider is checking the mouth. Make sure they're not in pain with their mouth. That should be one of the first things you probably ought to look at. Eliminate that, then go on to other possibilities. Part of your job will involve teaching proper oral hygiene. It also may involve actual hands-on direct oral care. Anytime you're going to be in someone's mouth, you're going to be assisting with their oral care, anything that involves the mouth, use gloves. It is absolutely required. There is no way you ever want to put your hand in someone's mouth without a glove on. There's a couple reasons for that. One, remember all that bacteria I said was in that mouth? Well, if you stick your hand in there without this glove on, your hand is not going to have that bacteria on it. Also, your hand has an assortment of bacteria anyway, and you don't want to add it to your client's mouth. The stuff that's already there, they don't need any more. So the best thing to do, put the gloves on, and then we don't exchange any. On your power toothbrushes, the handles have a larger grip. On a regular toothbrush, they're usually pretty small. So we may need to change something that makes it easier for it to be held onto by the client. If they have difficulty holding on to small things, then a toothbrush is going to be an issue. There are a couple different things that can be done. You can actually take a rubber band, tie it in a knot around your hand, successfully or not. You've got the toothbrush hooked to the hand now. It can be held onto then for brushing. This allows them to brush without dropping the brush. Okay. Other ways it can be done. You want to make this handle bigger? If you get hold of the styrofoam balls that you can get in any craft shop, poke a hole through it, stuff the toothbrush down in there and brush. They used to say tennis balls, but those get wet and soggy and yucky and they're kind of expensive to replace frequently. These styrofoam balls, it's not an expensive item, it gets yucky, toss it. Try another thing. Another item you can use, Velcro. You can get a piece of Velcro, put the toothbrush in the hand, wrap the Velcro around, hook it tight, and it holds the toothbrush in place. That'll work. You've probably heard to use a bicycle grip. For the handlebar grip, slide it down in that. That'll work. Another item is the foam tubing that you use with, a lot of times with the eating utensils or pencils, sometimes to enlarge a pencil. The same thing can be used to put on the toothbrush handle to enlarge it also. Okay, earlier I mentioned different points that I now want to demonstrate. One of the things I mentioned is that you always want the client or the individual having their teeth taken care of to be comfortable. If they're in an uncomfortable position or in some place that they don't feel good, then they're not learning much, and they're probably not cooperating much. So we need to make it as easy as possible on them and on ourselves. We've got someone that sits maybe in a wheelchair, in this case in a walker. Put them in front of a mirror where they can see what you're doing. It's important that they know what's going on. I'm going to explain what I'm doing as we go along, because in this case, the lady involved has sight difficulties. So I can't show her, but I can tell her, and that's what I'm going to do as we do this. I'm going to come up, do her help from behind, and I'm going to assist her in doing her own teeth, and I'm going to teach her as we go. I have the toothbrush in my right hand, and I'm going to hand it to her. See, you've got the toothbrush. My hand is right here and can help you, help guide you if necessary. Start out by showing me how you would brush your teeth. Okay, one of the things I want to show her is that when we do this, we want to jiggle the brush a little. Note that I'm not taking the brush away from her. I'm not telling her she's doing it wrong, reprimanding her, or anything like that. I'm helping her figure out how to do it right. Very good. So we've done that. Now, if she was unable to do it herself, I would come from here, place my hand where she knows where it's at, and this kind of stabilizes the chin and the head so that I don't go randomly hitting everything in sight. And I'm going to open it up a little, and I'm going to tell her what I'm doing. I'm going in, and we're going to brush these right here. All right, we're going to wiggle it around there. We're going to wriggle it around here. We'll move around the mouth all the way into all the positions. I told her what I was doing. I didn't surprise attack. Okay, so we've done that. I stood behind her. I put her in a position she's comfortable with. I explained what I was doing as I did it. And I let her contribute to her own care. I don't want to take away all her ability to take care of herself. I want to help her learn how to care for herself. So I've shown her how. I can do the same thing when it comes to like flossing the teeth with the flosser. I can do it from back here and explain what I'm doing as I do it. I'm going to talk the whole time. You need me to talk so you know what I'm doing, don't you?
That's right.
Even if you could see what I was doing, you'd still want me to talk to you.
Yes.
I'm not talking over her, past her, in spite of her, talking to her. Keep that in mind. You always want your client to be comfortable with what you're doing. I want to demonstrate some stabilization techniques. Now, we're not talking restraint. The stuff I'm going to show you today is just ways to stabilize the body so that none of us end up hurt. If a lot of people have problems with involuntary motion, when we try to brush their teeth or help them, the body jerks the hands jerk. The head can't be held completely still. Well, if it's in motion and I've got a toothbrush, that sometimes isn't the greatest combination. So we want to show you a way to be able to brush the teeth without holding them down, but yet keeping them safe. If someone is sitting in front of me, now these people, maybe they're in a wheelchair, or they're just sitting in a chair in front of me, and I'm going to either brush their teeth or help them brush their teeth. I want to do this from behind them. The reason for this is, if I reach around and brush, it's a natural motion for me. It's a natural motion for them. If they're watching me in the mirror, they can see what I'm doing, and it's perfectly natural. If I come around here and go like this to brush, I'm attacking. That's not comforting to anybody. Along with, I don't have good control. It's not a natural motion for me. So I'm going to stand behind like this. And let's say he has a little trouble just keeping his head from moving around. Well, if I'm chasing him with a toothbrush, that's not too safe. So what I want to do is I'm behind him, and I want to kind of cradle his head in my arm. Now, I can brace a little bit against him, slide the toothbrush in, and he moves, and I move with him. And nobody's getting hurt. I just go with the flow of his head motion. So this is safe, and you would feel safer that way also, correct?
Right.
Okay, what about the hands? Sometimes we have people that aren't able to control the motion of their hands either. Or someone gets in the mouth and it kind of startles them and their hands are jumping at them up there. Well, that can be dangerous too. So I want to help him hold his hand still. I can do this by there being two of us. One is going to get behind and do the brushing. I'm just going to take his hands and hold them. We're holding hands. I'm not holding him down. If your arm starts to jerk your arm for me. See? I can help him stop it before it gets up there and creates a problem. Sometimes the legs can be an issue. We can have legs that jerk around too, can't we? All right, so I'm going to get down here in front of you like this, and I'm going to kind of lean in, and I've got my arms helping hold the legs, my hands holding your hands, and I can kind of keep you from getting too wild, right? And the person is behind, the second individual in this case, is back there brushing the teeth. Everybody feels safer, but nobody feels held down. Because that didn't feel restrictive, did it?
No.
But it did feel safe.
Yeah.
Okay. As you assist with training and actual oral care, you will come across those clients who are either resistant to care, unable to cooperate, possibly have physical aspects, involuntary movement. Some of these things we're going to need to deal with. Also, if they're not accustomed to having their teeth taken care of, they may not want you in your mouth. We deal with a lot of people who are unable to understand what we're trying to tell them. They don't understand that we aren't doing anything, we're not planning on hurting them. We're changing their routine and they don't like it. So we need to make sure the routine, as we change it, it is not too offensive or upsetting to them. We need to find an environment where they are the most comfortable. It is not necessary to stand in front of the sink to brush the teeth. You can brush the teeth in a beanbag chair in the living room floor, sitting at the table, in a recliner, watching TV, listening to music. Any of these things you can do oral care in those environments. If someone is at their happiest watching the cartoons, laying on the floor watching cartoons, that's when they're their happiest. That might be a real good time to start dental care. Get down on the floor with them and start with just a damp toothbrush or something and begin acclimatizing them to the care itself. We are trying to desensitize them to oral care so that they become less resistant to the whole process. Another location you can do the brushing of the teeth would be like the shower or the bath. If it's going to be a sloppy process, that's probably a good place to do it. What about your attitude? How much does that count? If you come up to someone and tell them, okay, we're going to brush your teeth, and you look like this is the worst idea you think anyone's ever had, odds are they're not going to think it's too great an idea either. If you go up there smiling and, oh, look, we're going to do this, let's see if we can get your teeth clean, let's try this here, and you're upbeat and happy sounding, they may decide this might not be so bad. You're happy about it. Maybe I can be happy too. Your attitude is going to make a big difference in the attitude of the client. Fake it if you have to, but act like you think this is a great idea. Okay, I want to show you a couple different methods for getting into the mouth if Jason really doesn't want me there.
Okay.
He's very orally defensive. He doesn't want people around his mouth. This is a common thing. So I need to help him adapt to having something near his face. I'm going to take my hand and begin to rub it. And we're just talking to one another. And I'm just going to talk about what you did today, if you've been at work, if you went to school, what program you might have watched. Slowly working closer and closer to the mouth so that I begin to actually, I'm touching the mouth. And I haven't done anything too terrible yet, so, I'm just moving around and well, that's all right, you guess, right?
Right.
Okay, now, I finally got in there, right?
Right.
And I'm going to now just take a little look. Now, you don't like that, okay?
Okay.
But all I'm doing is looking, right?
Yeah.
And I'm kind of still rubbing, and we're still talking about it. What's your favorite music and everything? Now, this may take a day or two to get to this phase if you're very defensive.
Mm-hmm.
It's going to take a little time. I'm not going to go rub, open your mouth and scrub your teeth all in the same day. Okay? We got to work on it a little. I got in there a little bit. Now I can put a piece of gauze, a wash rag, something like that over that finger, and I'm rubbing now with that. And I'm getting in there a little bit, and I may move around. See, I'm just kind of rubbing.
Mm-hmm.
And we're talking about, does that feel good?
Yeah.
How's that feel? That's not bad, is it?
Uh-uh.
Okay, and see, I'm just rubbing. And you say, yeah, well, you're apt to get bit. Because sometimes we bite whether we meant to or not, right?
Right.
Sometimes we meant to. To avoid all of those things, when I go to get in this mouth, slide it right along against the cheek with this hand, my hand up against the bone. Now, obviously it's better if I can stabilize a little bit with the other hand too. I know where that bone's going.
Mm-hmm.
Even if you try to bite me, your teeth are set in the bone.
Mm-hmm.
So where the bone goes is where the teeth are going.
Mm-hmm.
If my hand's leaning against the bone, where the bone goes, my hand goes. So you start doing like this to try to bite me, well, my finger's going with, you can't reach my finger.
Uh-uh.
I'm safe. I can do like that, and then I can maybe start working the toothbrush in there a little.
Mm-hmm.
See, I'm kind of holding it out so I can get in. Now, you say, but I can't get my finger in there and the toothbrush in at the same time. I'm getting way too much resistance. Fine. Put the toothbrush in then. I don't have to be able to see it for it to do something, do I?
Mm-mm.
You can feel it brushing. I can't see a thing.
Mm-hmm.
Anything I do like that disrupts the colonization of the bacteria. The bacteria is what's creating the problem. Okay?
Mm-hmm.
So I'm breaking it up.
Mm-hmm.
Making it start over again.
Mm-hmm.
So I'm going to just, whatever I can do. I may not get but just a tooth or two brushed today,
Mm-hmm.
but that was a tooth or two more than I had brushed yesterday.
Okay.
So we made progress, didn't we?
Yes.
Okay, now I kind of want to get inside the teeth now. Well, that means
Okay.
we've really got to get your teeth open, don't we?
Yep.
To get in there. Got a couple options, a few things we can try. One is a wash rag. Open that up there, bite down on it. I can get in there with a toothbrush. Wash rags aren't scary, are they?
Mm-mm.
Every day, that's part of your life.
Mm-hmm.
So you can clamp down on that wash rag and you're not going to do any harm to your teeth or my finger.
Mm-hmm.
Open. That was one of our choices. Another choice sometimes is the end of a toothbrush. See, most toothbrushes now have some soft.
Mm-hmm.
I can put that in there on the back teeth
Mm-hmm.
You bite down on the handle of that, and I can get in over here and brush with another toothbrush.
Oh, okay.
The really nice thing is what we call the open mouth rest, open wide mouth rest. Put that in there, clear back. Now bite down on it for me.
Mm-hmm.
Look at that. Does that hurt any?
Uh-uh.
It's soft, isn't it?
Mm-hmm.
But yet, those teeth are apart, and I can get in there and brush now.
Mm-hmm.
Okay, when I pull it out, toss it in the trash can.
Mm-hmm.
It's a one-time use thing. Always, always put them clear back on the back teeth. Mm-hmm. Never in the front, because you can break the front teeth.
Mm-hmm.
Back here, you're not going to break the teeth.
Mm-hmm.
And it's going to hold it up. Now, you may have to, if you're really upset with me and don't like this, I may have to hold it in place while I brush with the other hand.
Mm-hmm.
But I've just made it safer on all of us, and you weren't hurting any, right?
Right.
And did I tell you everything I was doing as I did it?
Yes.
Even if you didn't want to hear it, I told you, didn't I?
Yes.
Okay, next thing is, this flosser has a long handle on it.
Mm-hmm.
I can floss somebody else's teeth with this without risking my own fingers. Now, you told me earlier that you have a problem with biting down on it, so put that in there. And then, see what I'm doing?
Mm-hmm.
Very simple, isn't it?
Mm-hmm.
I went down between your tooth, wiggled it around a little bit, and pulled it out.
Mm-hmm.
Now, if you have a problem with biting down on stuff, I sure want to use this, because I don't want you to bite down on this and smash it into your gums.
Mm-hmm.
Because that's kind of stiff, and that might hurt.
Mm-hmm.
Could cut your gums a little, couldn't it?
Mm-hmm.
So, it's nice and safe. I've explained everything I was doing.
Yes.
Let's say you know all about brushing your teeth. You do it every day.
Okay.
But sometimes I kind of notice there might be a spot or two you're missing.
Mm-hmm.
So one of the things I want to help you in training is I might get something like this, which this happens to be Spider-Man. It's a rinse that will stain the teeth where you missed.
Mm-hmm.
I can get you to swish that around in there every once in a while.
Mm-hmm.
Then you can look and we can talk about the spots you're missing, because it shows you exactly where you missed.
Mm-hmm.
Then you can practice on those spots.
Ah.
And you'll be able to see, oh, I did it right, I got them clean.
Mm-hmm.
Everything I do is to teach you and to help you learn how to do a better job. If it is at all possible for you to brush your own teeth, I want you to be the one doing it.
Mm-hmm.
If it's not possible for you to do it all the way by yourself, then I need to help.
Mm-hmm.
But I'm helping.
Mm-hmm.
Sometimes we have somebody that just can't do it by themselves at all. Just can't be done.
Mm-hmm.
But I still want to explain everything I'm doing when I do it.
Mm-hmm.
Because that's the polite thing to do, isn't it?
Mm-hmm.
Okay. That's what we want to do. We want to train so that you learn how to take care of your own teeth or learn how to allow me to take care of them. Okay, so how long do you try to continue to brush, attempting it? At least 2 minutes, no longer than 5. If after 2 minutes of brushing, they're pretty much clean, you've got it. Great, quit. But if not, keep going for up to 5 minutes. Stop after 5 minutes though, because at that point, they're not happy, you're not happy, and you can't even fake it anymore. So, at least 2 minutes, but no more than 5. There will be many different forms of resistance you'll come across. One of them is vomiting. What are you going to do if they vomit? Well, your first response is to back away and decide you really don't need to brush their teeth. That's the wrong one. If they vomit and you stop, you have then trained them to vomit and you won't bug them anymore. So it's never going to get done. But if they vomit, get in there, clean up the mess, and get back in the mouth. Now, you do not want to scrub hard after they throw up because that's coating their teeth with acid, and you don't want to scour that. But get back in the mouth, move that toothbrush around a little bit, and then quit. Do not let them win on that because you will have trained them to resist you in that way, and it will be successful. What if their mouth bleeds every time you get in there and try to brush? Should you keep going? Yeah, you should. The bleeding is because the gums have been irritated. If you get in there and clean that, you're removing the irritant, you're stimulating the gums, and they will begin to heal. If you continue to clean them on a regular basis, they will continue to heal, and soon you'll have pretty healthy pink gums. Now, sometimes you say, but this is bleeding way more than it should. If that's the case, if you really feel that they're bleeding too much, have their physician check to see if there is a medical issue. If not, get back there in there and brush. It's up to you to help them heal. All right, how long do I have to keep doing this? When are they going to quit resisting? Maybe never. The goal is to desensitize them to dental care. If you daily get in there and continue to try to clean, doing the best you can, they will slowly begin to accept it. If you get in there each day and you do something, even if it's only get one tooth clean, that's one more than was clean yesterday. Tomorrow, try to work on a different tooth. Be persistent, keep trying, and over time they'll begin to realize you're not really hurting them or anything. Maybe it's okay, and they begin to not put up as much of a struggle. Begin to let you do a little. Anything you can do is better than nothing. Something else that can help with oral care is what they eat as snacks. If you have crunchy, crisp snacks, apples, carrots, celery, even crunchy cracker type stuff, anything that will scrape the teeth as you bite into it is doing a little cleaning. Every bit helps. Obviously, we don't want to take away all their nice, really good snacks. So if you're going to have a sugary or a chewy snack, something that's going to stick to the teeth like that, that'd be a real good time to, after you have it, have them swish with water. Just swish the mouth out really good and spit it out. You've at least gotten the residue and stuff out, and have washed some of it off. That will help and get them through till that evening for time to be brushed.
Additional information. If you are assisting someone who requires medical immobility supports to ensure daily oral hygiene, please contact your local regional office and ask for the oral health coordinator who can provide you with additional resources. As a reminder, if the individual that you support is residing in community placement, the decision to implement medical immobility supports is one that needs to be discussed with the treatment team, including guardians and primary physicians, prior to implementation. Any specific medical immobility supports should be included in the individual's personal plan prior to implementation. While supplies last, oral hygiene items on the following slides may be ordered from your local regional office. To place an order, please request assistance from your service coordinator. Crest Spin Brush Pro Clean Powered Toothbrush Extra Soft. Crest Spin Brush Replacement Brush Heads Pro Clean Extra Soft. Open Wide Disposable Mouth Rests. Crest Pro Health Anti-Gingivitis Anti-Plaque Oral Rinse Clean Mint 1.22 ounces. Oral-B Essential Floss Wax Dental Floss Mint. Reach Access Flosser with 8 disposable heads. Surround Toothbrushes.